Coronavirus, a worldwide pandemic. This novel coronavirus has never been identified before in humans and should be evaluated for if symptoms persist of fever, cough, and shortness of breath. Even if you are not sick, limit exposure. Practice social distancing, avoid discretionary travel, work from home if possible. Healthcare workers continue to work hard every day, whether it is treating those who have been affected, as well as continuing to limit the spread of any other hospital-acquired infections. Also known as nosocomial infections, this refers to patients who acquire an infection while receiving treatment in a hospital setting for a completely different condition. Cross-infection within the hospital can come from a multitude of sources, whether it be contact through medical personnel and patients, patient flora with exposure to the external environment, a contaminated healthcare environment, bloodborne pathogens, as well as through invasive procedures. In this case, coronavirus is spreading through contact from person to person. Humans provide a favorable host environment for growth. Viruses are one of 4 basic infectious agents, and there are ways to identify which one we are dealing with. Bacteria are single-celled organisms that exist in millions in every environment. Some are harmful, but most serve a useful purpose. Fungi can live in the air, soil, water, and plants. There are also some that live naturally in the human body. Fungal infections are common throughout much of the natural world. In humans, fungal infections occur when an invading fungus takes over an area of the body and is too much for the immune system to handle. Lastly, protozoan parasites feed off of organic matter such as other microorganisms or organic tissues and debris. Protozoa are found everywhere. For infections to be transmitted, the following must exist: a host, which is an environment for the growth of these microbes, an infectious microorganism, a mode of transmission from either outside of the body or inside of the body, by direct or indirect host, a reservoir, which refers to the site where an infectious organism can remain alive and where transmission can occur. Wash your hands, especially after touching any frequently used item or surface. Avoid touching your face. Sneeze or cough into a tissue. Disinfect frequently. By following standard precautions, we are contributing to controlling the spread of infection. Hand washing alone can reduce the risk of respiratory infections by 16%. Did you know that 95% of people failed to wash their hands properly and do not know the best method? Check out CDC or FDA websites as a reference if you are not in that 5% who do know how to wash and dry your hands correctly. Personal protective equipment, or PPE, is another means of protection as it provides a barrier to prevent exposure. Contact precautions are intended to prevent transmission of infectious agents, which are spread by direct or indirect contact with the patient or the patient's environment, such as their dressings or bed rails. Airborne precautions prevent infectious agents when suspended in the air over long distances. Patients should remain in an isolation room, and a healthcare practitioner should wear respiratory protection. With coronavirus, droplet precautions are intended to prevent transmission through close respiratory or mucous membrane contact. Droplets can spread through coughing, sneezing, or talking. Patients infected are to be placed in private rooms and isolate. It is up to us and only us to make a difference. Do your part, flatten the curve, and stay safe.